Shoulder replacement surgery, also known as total shoulder arthroplasty, is a procedure where a surgeon replaces the damaged parts of your shoulder joint with artificial components made of metal and plastic. It's typically performed to relieve pain and restore function, particularly in cases of severe arthritis or other joint damage. Why is it needed? Shoulder replacement is often recommended for individuals experiencing significant pain, limited range of motion, or other functional limitations due to conditions like osteoarthritis, rheumatoid arthritis, or severe rotator cuff damage. Types of surgery: total shoulder replacement. Both the ball and socket of the shoulder joint are replaced with artificial components. Partial shoulder replacement, also known as hemiarthroplasty. Only the ball, which is the head of the humerus, is replaced, leaving the socket, or glenoid, intact. Reverse shoulder replacement. The ball and socket are switched, with the ball attached to the shoulder blade and the socket attached to the arm bone. This is often used when the rotator cuff is severely damaged. So, the procedure goes like this. The surgeon makes an incision, exposes the shoulder joint, removes the damaged bone and cartilage, and then replaces it with the prosthetic components. These prosthetic ball and socket are specifically designed to move smoothly within the joint. Recovery from shoulder replacement surgery typically involves a period of immobilization, physical therapy to regain strength and mobility, and gradually returning to normal activities.